Good afternoon, and thank you for viewing this presentation. In the coming slides, we're going to explore the drug sertraline. Sertraline is a selective serotonin reuptake inhibitor with the brand name Zoloft. We're going to go over the pharmacology and pharmacokinetics of this drug, including the mechanism of action and metabolism of the drug, as well as possible drug interactions, indications for use, and dosing. We will also go over adverse effects of sertraline, concerns during pregnancy or lactation, a cost analysis of the drug, and its application within the presented case study patient. Finally, we will talk about what is involved in the monitoring and follow-up for a patient when a provider orders sertraline. All of the sources used for information are cited within the slides, as well as on the slide titled references, and they will also be verbally cited throughout this presentation. First, let's discuss the pharmacology and pharmacokinetics of sertraline. According to Singh and Sadabadi in an article published in 2023 in Stat Pearls, sertraline is a drug that is taken orally and absorbed slowly in the body, being metabolized by many CYP450 enzymes, including CYP3A4 and CYP3A5, being renally excreted after it is metabolized to alpha-hydroxysertraline. It is extremely protein bound with a high affinity for albumin and works as a selective serotonin reuptake inhibitor. According to Hudart and others in 2023, sertraline works by suppressing SLC6A4, which is a substance responsible for transporting serotonin inside the neural pathways and thus increasing the available amount of serotonin in the brain. An important consideration to remember with its metabolism is that sertraline inhibits CYP2D6, which can cause elevated levels of phenytoin and can augment the effects of imipramine and desipramine. Sertraline has a range of indications for use, some of which are FDA approved and others which are off-label. According to the Stat Pearls article by Singh and Sadabadi in 2023, the FDA-approved indications include major depressive disorder, panic disorder, obsessive compulsive disorder, social anxiety disorder, premenstrual dysphoric disorder, and post-traumatic stress disorder. The indications which are not FDA approved at this time include premature ejaculation, generalized anxiety disorder, bulimia nervosa, body dysmorphic disorder, and binge eating disorder. Determining an appropriate dose of sertraline depends on the indication. For MDD and OCD, the starting dose is 50 milligrams daily. Maintenance dose for these disorders ranges from 50 to 200 milligrams daily, and adjustments can be made weekly in response to patients' results. For PTSD, SAD, and panic disorder, the initial dose should be 25 milligrams daily. This can be increased in 50 milligram amounts weekly if needed, with a ceiling dose of 200 milligrams daily. Finally, for PMDD, sertraline can be given and it can be administered continuously throughout the month or just throughout the luteal phase. If taken continuously, start with 50 milligrams daily and move up by 50 milligrams every menstrual cycle if needed, for a max of 150 milligrams daily. If it is taken intermittently, start with 50 milligrams daily, and if the patient is not responding as expected, medicate with 50 milligrams for the first 3 days of the luteal phase and 100 milligrams for the rest of the days. Finally, it is important to educate the patient that sertraline can be taken with or without food and at any time of day. The source for dosing information is, again, the Stat Pearls article by Singh and Sadabadi in 2023. Next, with information derived from that same article, we will discuss side effects. There are a number of potential side effects with any SSRI. Common side effects of sertraline include sweats, dizziness, nausea, lightheadedness, tremors, hallucinations, fatigue, weight gain, impotence, and loss of libido or inability to orgasm in women. More serious adverse effects include suicidal thoughts or behaviors, prolonged QT interval, an elevated risk of bleeding that could be compounded upon with the use of NSAIDs or anticoagulants such as Coumadin, or the development of serotonin syndrome. Serotonin syndrome usually happens when sertraline is taken alongside another medication that increases sertraline levels, such as tramadol, for example. The symptoms of serotonin syndrome include muscle stiffness, diaphoresis, hyperthermia, agitation, delirium, and tremors. Patients should be provided information about potential side effects in order to enhance drug compliance by ensuring that they know what to expect. Providers should also carefully review a patient's medications when ordering sertraline to minimize the chances of drug-drug interactions, as well as educating patients on the symptoms of serotonin syndrome. Contraindications for sertraline use include hypersensitivity, current use of certain drugs including MAOIs, or MAOI use within the past 14 days. Furthermore, according to Strawn and others in an article published in 2023 in Pharmacotherapy, there is a black box warning regarding the use of sertraline in pediatric, adolescent, and young adult populations, as it may increase the likelihood of suicidal behaviors. Next, we'll talk about special considerations for certain populations of patients, again using information from the article by Singh and Sadabadi in 2023. In elderly patients, sertraline should be utilized with caution as it has the potential to induce syndrome of inappropriate antidiuretic hormone or hyponatremia. Serum electrolytes should be monitored in older patients, as well as monitoring for symptoms of hyponatremia such as nausea, headache, or confusion. In patients with a cardiac history, such as history of a heart attack or heart failure, a baseline and periodic EKG may be obtained to monitor for cardiac rhythm changes, as sertraline has the potential to cause lengthening of the QT interval. In patients with thrombocytopenia or those on blood thinners, sertraline must be used cautiously as it does increase the risk of bleeding. Next, we'll talk about the use of sertraline in pregnancy. The risks presented to the fetus change throughout pregnancy, and according to the American College of Obstetricians and Gynecologists, sertraline is considered to be a Category C drug. According to Singh and Sadabadi in 2023, early in pregnancy, sertraline use is connected to an increased incidence of heart defects, including atrial or ventricular septal defects. Later in pregnancy, it's recommended to taper sertraline because its use is associated with increased hospitalizations and the need for supportive measures such as tube feeding or respiratory interventions. Thus, the benefits and risks of sertraline use must be considered throughout the entirety of pregnancy. In lactating women, while sertraline is a lipophilic drug and it does cross into the breast milk, its effect on a breastfeeding infant is found to be negligible, and therefore it is considered to be safe for breastfeeding. It's also important to note, according to Hudarts and others in 2020, that metabolism of sertraline in pregnant women may be accelerated, requiring higher doses. The next topic we will discuss is a cost analysis of sertraline. Even without insurance, sertraline is fortunately relatively affordable. According to GoodRx, a month-long supply of sertraline 50 milligrams taken daily is only $28 at CVS, with similar prices being noted at competing pharmacies such as Target or Walmart Pharmacy. This is less than $1 per day, with prices comparable to other SSRIs such as Lexapro. When prescribing sertraline for a patient, it may be important to mention the affordability of the drug to the patient, as well as programs such as GoodRx, which can even further lower the cost of the medication. Finally, we're going to discuss our case study patient, 32-year-old female university student named CJ. She expresses feelings of low motivation, hopelessness, difficulty concentrating, sleep disturbances, and persistent sadness. Her physical symptoms include low appetite and a slight weight loss of 5 pounds over the past 2 months. Her recent stressors include a relationship breakup, and she has a family history of her father being diagnosed with MDD in his 30s. Her treatment plan is going to be multifaceted, with both a referral for cognitive behavioral therapy and a starting dose of sertraline 50 milligrams daily. There is a plethora of evidence to support the effectiveness of sertraline, especially in the case study's age and gender demographic. For example, in an analysis completed of nearly 1,000 women of ages ranging from 18 to 85, published by Fagiolini and others in 2024, sertraline was proven to be markedly effective in improving HAM D17 scores throughout an 8-week period, which is a scoring system signifying a dramatic improvement in major depressive symptoms, including low mood, sleep disturbances, anxiety, and weight loss. In another study that was completed primarily of women aged 20 through 80, published by Ajay and others in 2023, sertraline was proven to alleviate psychological distress over a 1-year time period in about 91% of the study participants. Thus, there is concrete evidence of the efficacy of sertraline and the benefit the drug would have for the case study patient. Next, we'll go over the role of the nurse practitioner in prescribing sertraline and the responsibilities involved. In treating a patient presenting with the clinical signs and symptoms that CJ is reporting, the responsibility of the provider includes assessing the patient's symptoms, considering her coexisting medical or psychiatric conditions, her current medications, and selection of the appropriate medication and dose. A referral to CBT should also be completed for a multimodal tactic. Patient education is another responsibility of the nurse practitioner. Patient education should include the purpose of the drug, when and how to take the medication, and side effects of sertraline. The patient should be educated to take the medication once daily, with or without food, and should also be informed of potential side effects, including weight gain, sexual dysfunction, nausea, and vomiting. The patient should be advised to not suddenly stop the medication, as withdrawal symptoms of nausea, irritability, vertigo, lethargy, tinnitus, and many other symptoms could develop. Providers should also educate the patient regarding serotonin syndrome and to look out for symptoms including agitation, delirium, muscle stiffness. Finally, providers should educate the patient to be aware of any mood changes, including suicidal thoughts or behaviors. As a nurse practitioner, there's also a responsibility to continuously monitor the patient when sertraline has been prescribed. Patients must be routinely scheduled for follow-up visits, and providers should watch for changes in behavior, such as increased anxiety or suicidality. If the patient has underlying bipolar disorder, symptoms of mania, such as grandiosity or even psychosis, may develop. As previously mentioned, patients with underlying cardiac conditions should be monitored for EKG changes, while elderly patients should be monitored for symptoms of SIADH or hyponatremia. Finally, any changes in bruising or bleeding should be noted, especially in patients with thrombocytopenia or those on blood thinners, as sertraline may increase a patient's risk for bleeding. Sertraline is an SSRI that has a wealth of published evidence showing its benefits in alleviating the symptoms of many conditions, including major depressive disorder. It works by increasing the amount of serotonin available by suppressing the serotonin transporter SLC6A4. Sertraline can be administered for many individuals to enhance their well-being, even though it may have adverse effects such as the risk of serotonin syndrome, if proper education and follow-up are provided. Thank you again for watching this presentation.